Okay, my name's Leon Sadler, this is Louise Sadler. We've been asked to do a video, 15-20 minutes, about our experience. Now we've been working with the Photophoresis team for 6-7 years, I think. And rather than do it talk to camera, we thought it might be a bit more interesting, a bit more natural to do it talking to each other and bringing out the points. So we'll just start right in. We're going to, after the introduction, we're going to just go through the main body, look at the people, the processes, and the products. The people are the medical providers, like the doctors, the nurses, the consultants, but also the customer service personnel, the valet, and the things that make up the whole experience. Then product are the physical things that the hospital uses, buildings, access systems, access slipways for the valet, the electrical equipment, the electronics, the whole setup. And then lastly, the processes, which is basically how well and what our experience is of the staff using the facilities of the hospital, and then come to any conclusion and wrap up. So I hope that works. Okay, so I started being treated by photopheresis. Was it quite soon after my first transplant?
I think it was a couple of years into your...
Couple of years?
Yes,
yeah. So that would have been 2015. And so I've been doing it 6 years, or just a bit more. And it was in that basement room that had no external lights.
Yeah.
It was a cave. And
in the U of M...
Phillips Wagenstein
building.
Right in the basement.
Yes,
like
yeah.
2 floors into the ground.
Yes, yeah.
We were moles. It was a very small room, and the only thing around each patient was a curtain. But it made for a very noisy, collegiate atmosphere with nurses calling across to each other for advice or telling jokes, with the patients joining in and talking to each other and getting to know each other. It wasn't a great environment. I mean, it felt like a backwater.
Yeah.
But the people were
very friendly.
Very friendly.
Yeah.
And as a thing about how well managed they appear to be, I think most of them are still in the team. Well, no, I'd say half of them are still in the team, aren't they?
Yes, yeah.
I can't remember, but there are some that have left.
Yeah.
That antique guy. But it was good, and it was an experience. I was there twice a week from the start. Yeah?
Yeah, I think so, yeah.
And it takes how long each one?
Well, it was taking 3 hours
Right.
with the older machines. We had the older machines there.
Right. But they've got a bit quicker now.
Yes, the newer
Actually,
machine.
yeah, that's right. The horizontal one took up to 4 hours.
Yeah.
But it was, I think that's where Richard went to get the blood, to get the
blood harvest,
harvesting for my
the stem cells.
Yeah. So it had to be a nice environment because I was there so often and for over such a long time. Obviously, I'm not friends with any of the personnel, but I did make sure, and you made sure, that we nurtured a very friendly relationship between us and them, just simply because we were there so often. At that time, you had to drive me in every day. And so, how did you find that whole setup with the parking and stuff?
I can't remember much about. I think I had to drop you off.
They have valet parking.
Yeah, they had the valet parking, yeah.
in the wagon
Yeah,
scheme.
yeah.
So we used that.
Yeah, yeah.
But it did mean both of us lost a day.
Yeah.
Oh, not lost a day, but used a day. And we moved to the new building February 17, I think. And in many ways it's better. It's
yeah.
not
The
in all ways.
photopheresis section is definitely better because they've got more space.
Each person's in their own room.
You have your own room, and you know privacy is much better.
Yeah.
And
You got windows.
we've got windows.
Sunlight.
You're not in the basement. Yeah.
Yeah, it doesn't feel like an afterthought.
Yeah. Yeah.
Same staff, same manager.
Yeah, and
Linda.
there's an extra level of security because you have to go through the double doors
Right,
to get
right.
in, so that protects
Right.
the patients a bit. Yeah.
That's
and the
right.
Staff, yeah.
And in the other one, there was a desk in the hall
Oh,
where you
yeah.
checked in.
Yeah. Yeah.
But Lisa sat in amongst the machines.
Yes. Yeah.
That was where the reception desk was. It
Yeah.
wasn't in the hall. It was
Yeah.
just as you came into the room. And it was, God, it was amazing. It was so small. But it, with Lisa doing the admin and Linda doing the managing it,
Yes.
and the staff being very, very consistent, I don't think we had any problems.
No. And obviously, and they had newer machines at the new building.
Oh, but they had new
They had
machines,
upgraded the machines, so
Yeah.
they were quicker and
Yeah.
I think slightly easier to use by the nurses, easier for the nurses to use.
It wasn't a big transition either. I mean, because it was so the same, it was what they knew, the job they knew, the patients they knew, the colleagues they knew. The transition was literally just a building.
Yeah.
It wasn't like they moved over a weekend, I think.
Oh, right.
Didn't they?
Yeah.
We may have had a week, or my regime might have gone on hold for a week. I don't think it did.
Yeah.
But what do you find? How do you find the staff? And because you interact a lot more with a lot more people than I do, because you're all interacting with the security, the customer service, the reception, the telephone booking, the prescriptions, all of that around photopheresis,
Yes,
and also the insurance.
yeah.
So how did you find?
Well, I always check with photopheresis that the insurance covers the treatment
Because it's so expensive.
It is a very expensive treatment.
Each one is like $8 grand, I think.
Yeah.
So it's 64
You
grand a
check
month.
your insurance covers it.
Oh, yeah. And I have to carry the debt, which always worried you.
Yeah.
And Linda was really helpful.
Yeah.
And they wouldn't do anything without, if there was ever a problem, and there were a couple of times,
Yeah.
she would just stop. She wouldn't continue
Yeah.
until resolving it.
Yeah.
And she worked with us. She didn't just say talk to finance,
Yeah.
which was really good of her. Also, you did all the bookings for my other appointments, and sometimes we had to shuffle around.
Yeah.
And Lisa was always good at trying to accommodate.
Fit us in if she could, yeah.
And we reciprocated. We did everything we can. If they said, we'd like to change someone, or someone's come in from a surgery and he needs to restart, can you move to an afternoon or something?
Yeah.
And we've worked with them a lot on that over the years.
Yeah. Because each room can only have like 2 patients a day, one in the morning, one in the afternoon. So.
Right.
Yeah.
Which I can understand that the old place, because it could take up to 4 hours.
Yeah.
But I have a sneaking suspicion that if they're very tight on their scheduling.
Yeah.
But there's a fair amount of time where the machine isn't being used. So they might be able to, between 7:30 and 4:30, they could probably do 3. Because they only have like half a dozen machines. So there's not a huge amount of flexibility. I don't know, maybe I'll suggest it. But in the new place, the process is that I go in, I get weighed, I don't, I say hi to everyone and chat, and it takes me about 10 minutes to get into the room. But the process is you come in when you're called, you get weighed, you get taken into the room, you knock your shoes off, you get into bed, and then they finish the physical stats. So the blood pressure, heart rate, oxygen, temperature. And then they insert the needle and do the whatever blood tests. How many different, that's where I've had problems. How many different ports have I had? I know I've had about, it's getting on for 11 or 12, maybe a dozen different chest ports.
He also was like experimental. I had 2 of the ports were new to the hospital. They hadn't used the port.
The one before this one?
There was the Vortex port was new.
Right.
And then this one he's got in at the moment was new, and the idea was they clogged up less. They didn't get the blood clots so often in them.
The original one had 2 lumens. It had like 2 pipes
that you had to cover when you showered. And stuff.
I got infected and infected and infected.
Yeah.
Not because of the photopheresis team, but just because I had it for so long. It was.
Yeah, and you've had to have new ones put in quite often, haven't you, with that one? Yeah.
And then we went to the Vortex, which
was a bit better than the old one.
It lasted longer.
But it still did block up.
But I had 2, didn't I?
Yes.
I got infected with one, they pulled it out, gave it a rest for a couple of weeks, put a new one in, and then they put a new Vortex port in.
Yeah.
But I had the same problem again. And so they asked if they could try I don't remember the name.
I can't remember the name.
But the one I have now, which we've had, touch wood, no problems in for.
Lean forward a bit, you're out of camera.
Yeah. Oh. I've had no problems. How long have I had this one? 3 years? 2 years?
2 years, I don't know, a long time. And before they used to have to do the heparin to clear the clot.
Yeah.
It had to you had to inject it in, it had to sit in to clear it and everything. But this one hasn't had those problems, so this one's quite good, yeah.
No, and it didn't kill me. I mean, I came close with the MRSA that clogged up one of the ports, and then it came back. But I'm aware I'm at a teaching hospital and that they are at the forefront. Yeah. So I'm delighted to have the access to this new technology when it comes out. I believe that by a couple of hours or maybe a day, I was the first with this port.
Yeah.
Because I had a lot of people and doctors visiting to ask me about it.
Yeah. And these ports can't be used by other departments. They say you've got a port, you say yes, but then we say you can't actually use it if he needs other because it's a special needle and.
Right.
You need to know how to do it, and only the Apheresis people are trained on it.
So it's impressed.
At the moment, I don't know if that will change in the future. But
it's impressed on us. No one else misuse it.
Yeah.
Because everyone thinks it's just a port. They know what to do. But this one uses a big elephant needle that they put in, and then they pull out the needle and leave the sheath, the plastic sheath inside.
Right.
Partly through peripheral neuropathy and partly because we've done it so often. I don't use the Emla cream and it doesn't hurt. Or it doesn't, I get a spike every now and then, but I'm a bit worried that it might not fully heal because I'm doing it so often.
Yeah.
And they're using the same place.
Yeah.
But at the moment, they're trying to be clever and go around the whole.
Using different spots. Yeah.
What about the people? I mean, one of the things I find is because I'm there so much, and I said it at the beginning, I really have to focus on making it a happy place that I want to be. So I don't rush out at the end of any procedure as I used to do, because I need it to be somewhere I like going, hospital in general and photopheresis in particular. I find the staff really friendly, and that sounds awful. That sounds like really kitsch. Oh, they're friendly. I don't know. How would you say? They're knowledgeable and they're confident, and although they chat and joke, they're very meticulous in what they do. They're aware of the fact that their individual tasks may seem trivial, a tweak here, a change there, but the consequences from my side, the patient side, are huge.
So what do? They take the blood out of your...
Yeah, take out somewhere between 1,500 and 2 litres. And then of that, they spin it up and separate the buffy coat. And I'll explain now the buffy, no, I'm not going to explain the buffy coat. I barely understand it myself. And then they take about 150 to 200 millilitres, and they put this stuff called Bishop's weed in it, and then which photosensitizes the blood, and then they shine a particular wavelength of light on it.
To plump up the red blood cells.
Oh, right. Is that okay?
Pumps up the red blood cells, makes them more efficient, I think.
White. I think it's white because it's about the
yes.
And then they reinfuse it, and the whole process takes somewhere between, I think the record is by Lorna, of about 1 hour 43, but generally it's about 2 hours, which is a massive decrease in the old one, which was up to 4.
Well, sometimes it can take longer, 3.5 hours it can take. You need to set aside a whole half day.
That's right.
Yes.
If I ate pizza the night before, I come in and my blood's very lipemic, and
there's full of fat, too much full of fat. If you eat too much fatty stuff,
and then
they don't really like that if you do that.
Right, and the blood is too thick, the light doesn't shine through it and read correctly, and instead of running at 45 mil per minute, which I think is what the maximum, it runs at like 25, and so it takes 3.5 hours. No, you're right, I forgot that. The blood, the return should look like apple juice. If it looks like someone dropped lemon juice in milk, then it's a bad thing, and it takes a long time.
And what are the positive things of the treatment? You have less graft versus host disease.
Yeah.
That's what it's to treat.
Yeah.
Isn't it? Yeah.
Well, I have not suffered from acute graft versus host disease, but I've suffered from chronic graft versus host disease, and I've extensively. So I have it all over my body. Luckily, not my skin. One of the impacts is my eye, but the photopheresis I see as an alternative to the prednisone. And at times I've had to go up to like 120 mil of prednisone a day. And I think I've been on 80 mil for 2 years, or 18 months, and we've only just tapered it down to 6 milligrams a day, which is fantastic. Unfortunately, my bones are wrecked, my joints are wrecked. Avascular necrosis, necrotic arthritis, and osteonecrosis. But although prednisone is a wonder drug and has probably saved my life, the physical consequences are so massive, and I'm beginning to suffer from that. That having photopheresis, which is so uninvasive and has such a little impact on the rest of me as my body and my life apart from the time. That's where I think in my treatment regimen it's been a godsend. Yeah? It's right now I've tapered the prednisone, but I'm now trying to taper the photopheresis from 8 times a month to 6 times a month, just to try to spend less time at the hospital, because it's unusual for someone suffering from AML, the kind of complications I've got, to still be around after 8 years. And I'm still at hospital 2 or 3 times a week after 8 years. And if I can reduce that by reducing one of my photopheresis every other week, that's going to make a big difference. But overall, my experience has been very positive, both treatment-wise, physically. I am photosensitive, I always was, but it makes me hyper photosensitive.
So you have to leave the hospital wearing some glasses and probably a hat and long sleeves because you're photosensitive from the treatment,
right.
And they don't really want you to get too much sun.
And I have been photophobic, where you said I used to have to travel to my appointments with a sleep mask on because I was so photosensitive.
Yes, that was more your eyes.
Yeah.
Yes.
But the photopheresis didn't help.
Yeah.
But right now, touch wood, physically, chemically, I'm actually in a really good place. And I don't look forward to going to hospital to see photopheresis, but I'd really genuinely enjoy their company, and I joke with them, and they're very, when we've had bad things happen in our family, they've gone out their way to be kind. They brought us a handful of food, when things got very, very rough. So from a provision by the hospital point of view, really I can't think of anything negative, which is weird. I hadn't thought of that till this moment. Have you thought of anything
No,
negative?
it was very good. Yeah.
Well, I hope that this has been interesting and helpful. It's unscripted, it's off the cuff, it's honest, and thank you for the request, Lorna. Goodbye.